Hello and good morning, everyone. My name is Philip Montbleu, and I am the Health and Safety Director for the company. Today we're going to be talking about SBP Holdings COVID-19 Preparedness Plan. We're going to be discussing some safety measures that have been recommended to help slow the spread of the disease, as well as some specific policies and procedures that have been put in place to keep everyone here at SBP Holdings safe. I'd like to start off by saying that I hope everyone is staying safe and healthy during the pandemic, and I want to extend my thanks to all employees who've helped the SBP family of companies to operate continuously and safely for all employees, visitors, and customers at our sites. Our employees are the most important assets we have, and these programs have been put in place to ensure the safest working environment for everybody. Alright, we're going to start off with some general, simple safety precautions that can help slow or stop the spread of COVID-19 throughout the community. Although the knowledge about the virus and how it spreads keep evolving, based on the information now available, these measures can help curb the spread. The CDC has found that one of the most effective ways of preventing the spread of COVID-19 is limiting face-to-face contact with others, known as social distancing or physical distancing. COVID-19 is highly contagious and spreads mostly among people who are in close contact for a prolonged period of time. The virus generally spreads when an infected person coughs, sneezes, or talks, and droplets from their mouth or nose get into the air and land in the mouths and noses of other people nearby. A person who has the virus may not have any symptoms but may still spread the virus. A person can get COVID-19 by touching another person, such as with a handshake, or by touching another surface or object that has the virus on it, and then touching their own nose, mouth, or eyes. The virus can live on surfaces for up to several days, depending on the surface and other conditions such as weather. For these reasons, the CDC and other public health experts have recommended limiting contact with other people and common surfaces to limit the spread of COVID-19. The SBP companies need your full cooperation and compliance with these measures to make them effective in this new work environment, so please practice social distancing by keeping at least 6 feet away from fellow coworkers, customers, and visitors when possible. We also want to encourage washing your hands thoroughly with soap and water when you come into contact with anything that may be carrying the disease. If soap and water are unavailable, please use hand sanitizer containing at least 60% alcohol. You should wash your hands or use hand sanitizer, especially in the following instances: after blowing your nose, coughing, or sneezing, before, during, and after food preparation, after using the restroom, and after touching objects that may have been handled by a large number of people. Also, try to avoid touching your eyes, nose, and mouth. At this time, we also want to avoid all non-essential travel if possible. You must alert your supervisor in advance if you intend to travel to a known area with high concentrations of positive COVID-19 results. And lastly, we recommend wearing a face covering when you are present in any common areas where social distancing cannot be maintained. Check your local mandates to see where this is a requirement, as this will vary from state to state. Continuing on, here are some of the new processes and procedures that have been adopted by SBP Holdings to prevent the spread of COVID-19. Visitors to facilities will be limited, however they will be allowed on site if they are essential to business and employee well-being. All other visitors are prohibited unless they are essential to facility operations at this time. The SBP companies will routinely clean and disinfect all areas of the office, including individual offices and workstations, bathrooms, common areas, high-touch surfaces, and shared equipment. SBP are committed to teleworking arrangements to the extent feasible and consistent with business necessity. Please note that your supervisor or management will ultimately determine whether your position is one that can be performed away from the office. The SBP companies will also perform temperature checks in accordance with the SBP company's COVID exposure notification policy. All customers and visitors must wear face coverings or masks at all times if they are required to do so by state, federal, or local regulations. SBP may change your schedule to minimize the number of employees in the workplace at any given time. These changes may involve any combination of the following: continued or increased teleworking to the extent feasible, alternate day work schedules, staggered lunch and break times, and staggered arrival and departure times. SBP will notify you of any changes at the time of your return to work or as soon as practicable for later changes. Large in-person gatherings and in-person meetings of more than 10 people are prohibited in the workplace until further notice. Employees are encouraged to communicate with one another by gathering virtually using audio, visual, or other technologies. If you need to meet in person, there are some requirements that need to be met. Maintain at least 6 feet of distance between all participants. Comply with new capacity limits for conference rooms and other public spaces. Use alternate space seating arrangements across tables or desks to avoid direct face-to-face positioning. You must engage in regular hand washing or use of hand sanitizer. And do not attend if you are experiencing any COVID-19 symptoms or if you knowingly have been exposed to someone who has or is suspected of having COVID-19. With all of this being said, if you believe that you have contracted the disease, then stay home and immediately notify your supervisor that you are having symptoms. Symptoms of COVID-19 can include, but are not limited to, fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. If you are experiencing any of the symptoms listed above, or other symptoms of COVID-19 as identified by the CDC, immediately notify your supervisor and do not report to work. If you are experiencing any of the symptoms that we just described, do not return to work until all of the following conditions have been satisfied: a negative COVID-19 test or alternate diagnosis, such as a flu or similar disease, or if you have been without the fever for at least 24 hours without the use of any fever-reducing medications and all other symptoms have dramatically improved. If you have been diagnosed with COVID-19, you may not return to work until 10 working days have passed since the date of your first positive diagnosis. This time off will be covered by SBP, providing you can supply a physician's note confirming your positive result. If you or anyone in your household have been exposed to someone who has or is suspected of having COVID-19, you may return to work with the condition that you do not have any symptoms that we have previously discussed, and you continue to participate in wellness and temperature checks for 14 days. During this 14-day period, check your temperature twice a day, watch for any symptoms of COVID-19, practice social distancing, and wear proper PPE to ensure the health and safety of everyone at your location. Before I end this video, I would like to take a minute to discuss the upcoming flu season. This year's flu season will coincide with COVID-19, and with that, it brings an extra layer of precautions that we must take and extra challenges with dealing with the flu season and the pandemic simultaneously. The ultimate goal is to have all employees remain safe and healthy during the winter months of the pandemic, and one way to help ease the strain on medical facilities is to consider getting a flu shot. Every year, the expected common flu strains are analyzed and a vaccine is implemented to reduce the infection rate or hospitalization rate for the flu and most common strands. As you can imagine, this year it is especially important for us to stay vigilant and prevent illness and limit exposure for either the flu or COVID-19. And as such, we recommend that you speak with your primary care physician about the possibility of getting the flu shot. Lastly, I would like to point out that SBP prohibits any form of discipline, reprisal, intimidation, or retaliation for reporting a health or safety concern, or a violation of this policy, or for cooperating in any investigation. Employees have the right and obligation to report work-related injuries and illnesses, and SBP companies will not discharge, discriminate, or otherwise retaliate against employees for reporting work-related injuries or illnesses. As always, if you have any questions or concerns regarding this policy, please reach out to your management team or to myself, Philip Montpleau. And as always, you can always submit questions to questions@sbpholdings.com, and we will reach out to you with questions and answers as soon as possible. Thank you.